The question is a good one because it emphasizes the point that people routinely get basic screening for breast cancer with mammography and also get basic screening for colon cancer with a colonoscopy. Yet we haven't really instituted that idea of widespread screening. The guidelines that we just brought forth didn't exactly endorse generalized screening for every adult, but they did lower the bar to have, if you had at least a 5% risk of a heart attack or a stroke, that it's certainly reasonable to consider a coronary artery calcium scan. And I've certainly had patients who, especially women, who have a family history of heart disease, and with the calculator they come out to a 1 or 2% 10-year risk of a heart attack or stroke. But because of their family history, I got a coronary artery calcium scan, and the finding of mild to moderate coronary calcium was very abnormal for their age, and that led us to start statin therapy much sooner. So we've sort of moved away from the idea of doing routine stress tests in middle-aged adults. The yield is so low. But for people above a certain age, and often that's 40 years in men or 45 years in women, selective use of coronary artery calcium can be very helpful, and especially in someone who has some of these risk-enhancing factors like a family history of heart disease, high triglycerides, a high lipoprotein a. So these guidelines don't believe that every adult needs to be screened with a cardiac CT, but we've sort of expanded the group of people where we've pointed out that that determination can be very helpful in deciding what the best long-term treatment should be.